What is genetic screening? Well, genetic screening is a type of medical test that identifies changes in chromosomes, genes, or proteins. The results of genetic tests can confirm or rule out a suspected genetic condition or help determine a person's chance of developing or passing on a genetic disorder. There are many different kinds of genetic testing. These include newborn screening, diagnostic testing, carrier testing, prenatal screening, pre-implementation, predictive and pre-symptomatic, and forensic. Today we're going to focus on prenatal screening.
For many reasons, prenatal screening is a controversial issue among parents and the members of the disability community. It involves closely held attitudes towards abortion, the beginning of life, God, fate, disability, social responsibility, and the definition of a good life. Deciding whether to test an unborn child can be difficult, but ultimately it is the parent's choice.
Before getting into the pros and cons of prenatal screening, you first must understand what prenatal screening is. Prenatal screening is used to detect changes in a fetus's genes or chromosomes before birth. This type of testing is offered during pregnancy if there is an increased risk the baby will have a genetic or chromosomal disorder. In some cases, prenatal testing can lessen a couple's uncertainty or help them make decisions about a pregnancy. Some conditions of prenatal screening can determine if one has Down syndrome, Duchenne's muscular dystrophy, cystic fibrosis, Tay-Sachs, sickle cell, anemia, thalassemia, spina bifida, and neural tube defects.
There are several types of prenatal screening. Some routine tests are blood samples and ultrasounds. A cheek swab can also be taken. An amniocentesis can be performed, which is a sample of the amniotic fluid. Also, a chorionic villus sample can be taken, which is a sample of the placenta.
As far as cons go for genetic screening, I'm going to first start with the accuracy. It is not a very accurate thing to screen for different genetic disorders, so there's a chance for false positives and false negatives. And because of that, a woman may decide to abort their baby because of the result of a false positive if they have, say, a gene for Down syndrome. On the topic of abortion, a surprising fact that I actually just learned is that there's parents who would consider even aborting their fetus if they even had minor defects, such as like nearsightedness, and that's where the controversy comes into where is a disorder, where should the baby live, and where should they not live. So there's an issue that there could be a program that leads to eliminating those who are unfit for the society and allowing only those who are fit to live and be able to reproduce in our society.
Those are some good points that you have, but I found some pros for prenatal screening. One is that it informs parents of a disease that their child can have. Although you said there are many false positives, there are a lot of correct diagnoses. And by finding out what their child has, this allows ample time for the parents to decide whether they want treatment, how to treat it, or if they want to get an abortion, which although is really unfortunate, some parents, it might be the best option in very severe cases. If the parents decide to keep the baby, it's very important that they know what exact diagnosis that their child has. This can help with planning the birth and making sure that all their special help is there if it's needed. The answer could simply just be changing habits for something less severe. This can also help avoid complications because now the mother and the parents know to look out for warning signs of any potential complications.
Marissa, I can see your reasonings, but here are some other reasons why I'm against genetic screening. One is there's this confidentiality aspect of it. Genetic Information Non-Discrimination Act of 2008 doesn't even give specific guidelines for balancing patient confidentiality with the patient's family profile to the family. So when a woman finds out that she may be having, say, a baby with Tay-Sachs or something going on with that, there's stress of telling her partner or not telling her partner, whether the partner wants to give up the baby but she does not, or whether she wants to give the baby and the partner does not. It causes a lot of extra worry, stress, anxiety. If there is a positive, whether they give up the baby or not, they have to go through the rest of the pregnancy being very more anxious about the baby, and their own relationship suffers because of that. Another point that disability rights activists actually make is that as healthcare increases in cost, they fear that instead of making accommodations for disabilities in the society, that they'll actually take the easy way out and just make things more difficult for people who have kids with disabilities, because there's now the screening for disabilities while prenatal. Second, it raises the issue of selective breeding. It takes it into genetic, where another issue would be genetic engineering of what you pick and choose for your child when they're born. Another thing would be expense. The screening can just, keep increasing in cost of how much it is to have these screenings done for different disabilities. And the last point I just want to make is that there's also an age discrimination. Over 35 years old, they tend to definitely want to screen you, which can be a good thing because there's more of a chance for Down syndrome and other syndromes that the baby can have. However, they push it along more for these mothers, even if they do not want it, to have these screenings done and just to have them done, and they might not even really want it. So that's another reason why I am against it.
I see why you're against it, but I have some more reasons why I'm for prenatal screening. Counseling and emotional support is very helpful for patients to get when they find out that they have a baby with, say, Down syndrome or anything like that. They can learn how to cope with it, and they can learn how to raise the baby once it's born. Also, knowing what your baby has can help start treatment earlier if it's possible, which could help them in the long run. Something I found interesting was that there has been some success in treating alpha thalassemias and combined immunodeficiency syndromes by using fetal bone marrow transplantation. And along those same lines, knowing that your baby has a disease can give you the opportunity to be in research projects and maybe get new and upcoming medications to help your baby. And last but not least, a simple pro is finding out paternity if you don't know who your baby's father is.
Ultimately, it's important to be educated upon what is genetic screening, what you're getting yourself into, the risk factors, and just know everything you can before you do it.
There's good pros and cons for prenatal screening, but ultimately it is the parent's decision if they want to be tested or not.